So we have a short time if any quick questions. So please.
I just wondered that just what you said in terms of the maintenance of the cohort, because we're dealing with a lot of new genetic cohort studies, but in the little bit of involvement that we had in re-interviewing people about stress events, their commitment to it as a cohort of people who were engaged in war and similar occupations, and then that tremendous participation, even though they knew they weren't getting real clinical surveillance, they were part of that, and they contributed to maintain the study during times when the grant levels weren't that high. How do you do that? We're projecting new genetic cohort studies for the aging for young children, but without any of the mobilizing and continuity factors that you were able to elicit in this and really define the study.
Yeah.
Most cohort studies aren't like that, and you were accused of having healthy young men who weren't dying quick enough early on in it. Now you may have successfully aging old guys who may be living beyond the life limits of their cohort.
Yeah. So the group of people who seem most interested in what we're doing right now, it now includes Veterans Affairs Canada and the Canadian Forces. Of course, Veterans Affairs looks at health of veterans, but so many visions of that right now might be the young man coming back from Afghanistan or somebody who may have been in Korea. They've almost, the World War II veterans are these men that are 90 years old, but there's still a tremendous number of them in the study. I've been invited to give a session 2 weeks from yesterday at the Canadian Military Veteran Health Research Forum in Kingston. And Veterans Affairs has asked to meet with me about exactly what we're talking about, Joe, about what they can learn from very healthy older veterans. So we'll report back in a couple of weeks.
Sure.
Thanks, Bob. Fascinating presentation. One of the advantages of a prospective cohort study is the sequencing of events and a little more strength of the hypotheses of cause and effect. So I guess my question is, have you, or do you think you can learn from this, what independent decisions or actions were taken by men who had more successful aging, lived longer without dementia, however you want to look at it, that could give advice to us guys in the audience and us guys in the population, for whom it's not too late to make some good decisions to make sure we can die in good health on our motorcycles.
Yeah. So that's just one more thing you and I have in common, Dr. Kettner, that our motorcycles. But the strength of this study, and when I speak with some people who want to be involved, or co-investigators or students, is to think about what we can do with the data that we've got that you can't do with other data sources. So for example, I'm in a huge department, and there's the Manitoba Center for Health Policy, and there's the Manitoba Follow-up Study. Now, there's a wealth of data and strength in both realms. What we have is detailed information on men when they were healthy, before they got sick. There's lots of studies around that are looking at what's the best medical treatment or pharmaceutical treatment to use once you get sick, and that's not the strength of this study at all. So maybe perhaps like Julia's, Dr. Yonova's project, where we were able to go back and actually do a chart review. There's more data in our files than we have coded right now. And she's going to look at the details of the evolution of metabolic syndrome. So if you have to have 4 or 5 things on a checklist before you get diagnosed or labeled as metabolic syndrome, does it matter what order these things happen in, and so on. And we'll have the details and information on that. Does it matter how long it takes to evolve? And so, in part, maybe that can answer the question of, just because you get diagnosed with something, they're not all the same. Now, the other piece that you're saying about keeping old guys healthy longer, the paper that's coming out next month in the Gerontologist is looking at taking a man on his 75th birthday, and what do you know about him on that day, and how is that going to predict whether he's still alive when he's 85? So we did this analysis a couple of years ago, and so what do we know about him on his 75th birthday? Well, we've got like years and years of data prior. So we picked out 6 chronic conditions. We picked out heart disease and stroke and cancer and COPD, and diabetes and hypertension. And we've controlled for, smoking and or, BMI and some other things in the model. And the notion isn't, and all of them are significant independent predictors of mortality over the next 10 years. And they're independent, so there's no interaction between them. All of them are important. The 6 of them separate out a risk between 25% and 5% mortality. It's a strong design because we've got complete data on all of these guys. We did the analysis after everybody was already 85. But the message is, never mind when you're 75 years old, this is stuff that we'll know will happen to you later. This is things that, as a physician, a family physician, you should be talking with your patients earlier on in their life. We looked at how long had the man lived with each of these conditions before his 75th birthday. Did that matter? Does it get worse if you lived with them longer or shorter? So read the paper next month in the gerontologist. In terms of things like, you mentioned things like dementia or perhaps institutionalization. So the paper that I presented at the Canadian Association of Gerontology a month ago in Vancouver was looking at whether or not themes that are reported on a man's definition of successful aging were related both to mortality and longer-term outcomes in terms of interest to long-term care. And there are. So what we've discovered is that there's, or not discovered, what we've presented is, for example, there's 4 themes that might show up on a definition of successful aging that are related to mortality. And they're things like keeping busy, being useful, volunteering, being content. So if you have those things in your definition of successful aging, those things all are related to a better long-term prognosis. So how might you want to change what you're doing now, Joel? Keep busy, be content. Are you content, generally speaking?
I am now.
No, you are now.
After this presentation, I am now content.
Yes. So how you feel about things is an important.
Much better right now.
Yeah, much better.
It's too late to enlist.
Okay, please join me to thank all the speakers.